Caring for the Native American patient. According to the most recent census, Native Americans account for 2% of the U.S. population, or 5.2 million people. While they are certainly not the nation's largest minority group, their presence is well established throughout the United States, with 562 federally recognized tribes and nations. In general, Native Americans are known for being a very tight-knit and private culture, often secluding themselves from the outside world. This makes Native Americans one of the most misunderstood cultures that we as healthcare providers engage with and care for. The purpose of this presentation is to educate the public on how to better care for the Native American patient throughout the lifespan. By acknowledging the values and beliefs of various cultures, we can provide patients with a better healthcare experience. Native Americans are one of the most unique cultures in America today. These individuals are deeply connected to our country, having been here long before the first settlers. As many of us have read in history books, Native Americans have experienced quite a traumatic past. They were driven from their homes and had their land stolen, and many were killed. As a result, many Native Americans have secluded themselves from the outside world. Within the Native American culture, there are hundreds of tribes, all of which have varying beliefs and values. This presentation will focus on the Native American culture as a whole. Three of the most valued concepts in the Native American culture are those of nature, respect, and harmony. Values and beliefs related to healthcare. Native Americans define health as having harmony with nature. They believe that health is a reflection of an individual's relationship with nature and the environment, so the absence of disease does not necessarily mean an individual is cured. Health is not only a physical state, but one that interconnects the mind, spirit, creation, and creator. Many Native Americans use a combination of traditional healing as well as Western medicine when it comes to illness. Native Americans believe that individuals have the power to heal themselves. However, guidance and knowledge from outside sources are required to do this. Therefore, the patient should be an active participant in his or her recovery. Native Americans view illness as a learning experience. Ceremonies and herbal remedies play a large role when it comes to illness and the healing process. Communicating with Native Americans. While most Native Americans speak English, there are a few tribes, like the Navajo, whose English-speaking skills are underdeveloped. Therefore, it is important to ask the patient if they would like an interpreter. Native Americans often speak softly and with restraint, and view speaking in a loud tone or too quickly as rude. Interrupting is also viewed as rude, especially to an older individual. Therefore, it is important to allow the patient to finish what they are saying. Native Americans view prolonged eye contact as rude, especially towards an elder. An individual's head and hair are considered very sacred in this culture. Therefore, healthcare professionals should avoid touching this area unnecessarily. Many Native American tribes do not have a written form of their dialect, meaning a large population of Native Americans may not be able to read or write effectively. It is important to keep this in mind when having these patients read or sign documents. Family dynamics. Elders and children are highly valued. Matrilineal heritage is important in most tribes. This means that grandmothers are the central figure in the family, and the decision makers are consulted when it comes to matters such as healthcare decisions. Family and group are valued over the individual. Therefore, the family as a whole is often consulted on important matters. Men are considered protectors of the family and community. The Native American community. Nursing the Native American community can prove to be a complex and challenging undertaking. Several things that should be taken into account when caring for Native American community are: most Native American communities are very isolated from the rest of the country, leaving them without proper access to health care. Many Native Americans are considered to be living at or below the poverty level. Therefore, they may not have sufficient funds to utilize the healthcare system. Additionally, many individuals in this community may not have access to transportation. Caring for Native American childbearing women and their families. Many Native American women of childbearing age use herbal supplements that may affect their health and the health of their baby. Therefore, it is important to inquire about herbal supplements that they may be taking. As we know, prenatal appointments provide physicians the opportunity to identify and improve the prognosis for patients who are at high risk for negative birth outcomes. However, Native American women are less likely to obtain prenatal care than other cultures. This can lead to many health disparities such as low birth weight infants or preterm births. Therefore, education is very important when it comes to pregnancy in this community. Modesty is an issue for many Native American women. Therefore, some individuals might feel uncomfortable seeing a male physician during pregnancy. Many women prefer that only females be present when giving birth. Caring for Native American youth. Accidents, homicide, and suicide kill American Indian children and youth in far larger numbers than any other racial group. Therefore, it is important to assess Native American youth's mental and behavioral health. American Indian youths are also at higher risk for alcohol and nicotine abuse. The nurse should assess the intake of such substances and determine their risk for dependence. There is a strong elder-youth bond within this culture. Elders often spend a great deal of time with children, passing down their knowledge on a variety of topics from language to farming. Therefore, when dealing with Native American youth, it is important to include family and elder members of the tribe in the conversation. Native Americans have the highest school dropout rates of any group. Therefore, healthcare professionals should take this into account when dealing with these patients. They might not have the literacy and language skills to understand everything you are explaining. Caring for the Native American adult. As explained earlier, when communicating with a Native American patient, it is customary to use a soft tone of voice, listen without interruption, and avoid prolonged eye contact. Foods such as corn, beans, and squash are staples in the Native American diet. In fact, corn is considered sacred by many tribes. Additionally, the Native American diet is high in saturated fats and carbohydrates, which is why diabetes is one of the leading healthcare issues. This should be taken into account when assessing your patient's dietary habits as well as preparing their meals. Many Native Americans in today's society use a combination of traditional healing with Western medicine. Because of this, many patients may be using supplemental herbal remedies. It is important to address this as many of these herbs can have adverse side effects when used in combination with prescription medications. Native Americans are also at higher risk for alcoholism, tobacco use, and substance abuse than other cultures. This can lead to other issues such as depression, violence, and suicide. Because of this, it is important to talk to these patients about the use of such substances as well as assess their mental health. Many Native Americans live at or below the poverty level. Because they live in isolated areas of the country, these individuals tend to have less access to healthcare facilities. This is important to consider when deciding on a plan of care for these patients. Caring for the Native American elder. Native American elders are well respected in their culture. They impart knowledge on other members of the tribe and are viewed as keepers of tribal tradition. Therefore, when caring for this patient population, it is important that you treat them with the utmost respect. Native American elders are regarded as strong individuals. Therefore, they tend to be more stoic and less likely to verbalize when they are in pain. It is important to be aware of nonverbal cues that these patients are experiencing pain, as well as address their pain more often. Many Native American elders were born and raised in a very dark time during our nation's history. They and their ancestors were displaced, run off their land, and victims of unspeakable crimes. While many Native Americans were taught not to view themselves as victims, their history may predispose them to issues with trust. Therefore, it is important to build a rapport with these patients. Native Americans are a vibrant and deeply spiritual culture. They place great value on the concept of respect. They value the group over the individual and believe that the concept of healing is more than just finding a cure. With these things in mind, healthcare professionals can better care for this patient population. Providing culturally competent care to individuals not only allows for a better patient experience, but a better experience for the nurse as well.